Keeping your child in school is the best way to give them a brighter future. But what happens when they're sick? Well, that's where Interact for Health steps in. Its school-based health centers can help treat illnesses beyond what a school nurse can do, plus better prevent things such as asthma attacks. Take a look at how it works.
You know, one of the most exciting things we're doing is the school-based health centers. And the exciting thing is we can keep kids in school. They have a better chance to learn and to graduate and become productive citizens. Not only that, we can monitor the chronic diseases like asthma. 10% of all kids in Cincinnati Public School have asthma. And you can imagine with asthma, you're going to have episodes where you need to go to the emergency room. And if you're at school, your parents got to leave their job. But here, by having a school-based health center, you're able, one, stay ahead of that to prevent those acute episodes. And if, before they happen, provide a treatment in school, have the kid there in the nurse's office for an hour, and then back to class. Currently, in our footprint, we have about 50,000 students are being served through about 38 school-based health centers. We work on a regional basis, and we try to work in 20 counties. So some are in Cincinnati, some are in Hamilton County. We're currently trying to open some in Brown County, Claremont County. Number one, I think the school-based health center can do all the physicals that you need. You know, you have so many schools that have a lot of athletes, and they need to have a physical exam before they can participate. That can happen there at school. Again, it saves the parent from missing a day of work. It's right there where the child is. The child can get that physical exam and be back in a classroom. Secondly, kids can get their vaccination. They can be reviewed. If they don't have the right vaccinations, they can get that at the school. We'll only open a school-based health center that can provide not only the basic health needs, but meet dental, vision, and we're hoping to add a food pantry as well, along with emotional and mental health issues that will be needed for that school as well. You know, in the school-based health center, you have a skilled nurse practitioner. It is not the school nurse. In fact, in some of our schools, we have both the school nurse, who handles the school nurse type problems, and we have a skilled nurse practitioner. Oftentimes, they will detect things that will need more diagnostic work, a child that will need to be followed by a physician, maybe they hear a murmur, they need to see a cardiologist, so they can make the appropriate referral for kids that have problems beyond what can be treated in a school-based health center. First thing I think grandparents should do is to find out if their school has a school-based health center, and if not, advocate for one, because there certainly is an advantage. And then once they find out their school does have it, they make sure they sign the consent paper, because the children cannot be treated without that consent being formed. And most schools will not allow the parent to call in and do it verbally. So if there's an issue at school, you can't call and say, okay, I now give you permission over the phone. No, they want that consent form signed so you understand all the issues. And again, as I said, it's a real advantage for the child, for the school, and for the parents. It's a win-win.
What a great idea. Now, for more information on how to keep your kids healthy, you can give Interact for Health a call, 888-310-4904, or check them out online at interactforhealth.org. Mona?